Measuring vital signs. Measuring a person's vital signs means measuring the person's temperature, pulse, respirations, and blood pressure. Measuring these accurately provides information about a person's health. Learning how to take accurate vital signs is an important responsibility for a health care worker. Temperature. Temperature measures the amount of heat in a person's body. When a person's muscles work, heat is produced. When a healthy person works hard, more heat is made. The body perspires to help keep its temperature normal. When a person becomes too cool, the body shivers, so the temperature may also be abnormal. A temperature reading above normal is called a fever. An elevated temperature could indicate some type of health problem. Temperatures may be taken with a thermometer placed in the mouth, oral, under the arm, axillary, or in the rectum, rectal. The most common way to measure temperature is orally, while the axillary method is the least accurate way of measuring temperature. It is the safest. The most accurate way to measure the temperature is rectally, but it is rarely used. Never measure a person's temperature orally if the person has a history of seizures. Use the axillary method of measuring instead. Normal body temperature measurement varies depending on the method used to measure temperature. The normal ranges are: axillary 95 to 98 degrees Fahrenheit, oral 96 to 99 degrees Fahrenheit, rectal 97 to 100 degrees Fahrenheit. A thermometer is a hollow tube containing a non-mercury substance. This chemical expands when exposed to heat, such as from a person's mouth, underarm, or rectum. The outside of the thermometer is marked with lines and numbers that allow accurate measurement of the temperature. An oral thermometer is used to measure oral and axillary temperatures. Oral thermometers usually have an elongated bulb and may have a blue or green stem end. Rectal thermometers are used to measure rectal temperatures. The rectal thermometer has a rounded bulb and may have a red marking at the stem end. A digital thermometer eliminates reading error and small differences in glass or plastic thermometers. Digital thermometers may be used to measure oral, axillary, or rectal temperatures. A disposable probe cover protects the stem when the thermometer is in use. If you question the reading of the digital thermometer, check to see if you need a new battery. You may also check the accuracy of your reading with another digital thermometer or with a glass thermometer. To read a glass thermometer, read the short lines as well as the long lines. Each short line represents 2/10, 0.2, of a degree. Each long line represents 1 full degree, 1.0. Only the even degrees are numbered, 96, 98, 100, etc. on the thermometer. The long lines that are unnumbered are the odd numbers, 97, 99, 101, etc. If the non-mercury liquid should fall between two small lines, round up to the next higher small line so that the reading will always end in an even number. The reading should never end in an odd number unless a digital thermometer is used. The reading on thermometer below is 98.6 degrees. The reading on thermometer below is 100.2 degrees. Choose an appropriate route: oral, axillary, rectal. Procedure guide for using a glass or plastic thermometer. 1. Wash your hands. 2. Use a disinfected thermometer. 3. Shake the thermometer so the reading is below the lowest number. 4. Place the thermometer inside a plastic shield cover. Axillary. Place the thermometer under the person's armpit. Hold the arm tightly against the chest. Leave the thermometer in place for at least 10 minutes. Oral. Place the thermometer under the person's tongue for at least 3 minutes. Rectal. Lubricate the bulb end of the plastic shielded thermometer. Have the person lie down on their side. Insert the thermometer into the rectum 1.5 inches. Hold the thermometer in place for 3 to 5 minutes. Never leave an individual alone while measuring temperature rectally. 5. Remove, wipe, and read the thermometer. Hold the thermometer at eye level, slowly rolling it between the thumb and forefinger until a colored line appears and focus on where the line stops. Read the temperature to the closest line and record. 6. Shake down the thermometer. 7. Clean the thermometer with an alcohol pad and rinse in cool water. 8. Wash your hands. 9. Record the reading on the vital sign record sheet and in the HCC. 10. Report abnormal readings, above or below the normal range for the type of temperature being taken. Pulse. A pulse measures how fast the heart is beating. A normal adult pulse beats 60 to 100 times each minute. To be most accurate, the pulse should be measured for 1 full minute. The most common way to measure the pulse is to feel the artery in the wrist, radial pulse, as shown in illustration, and count the number of beats. Use your fingertips, not your thumb, to feel the pulse. Another way to measure a pulse is to use a stethoscope placed over the heart area and count the sounds of the heartbeats. Checking a pulse in the neck, carotid artery, is not recommended unless ordered by a health care provider or no other method is easily available. Respirations. Respiration rate measures the number of breaths a person takes in 1 minute. 1 respiration is equal to the chest rising when the lungs fill with air, inhaling, and the chest falling when the air leaves the lungs, exhaling, 1 time. Respirations may be counted by watching the number of times the chest rises and falls in 1 minute. They may also be measured by placing the hand on the chest or stomach and feeling the number of times the chest rises and falls in 1 minute. The normal rate is 12 to 20 respirations per minute. Blood pressure. Blood pressure measures the force, pressure, of the blood on the inside of the arteries as the heart beats to circulate blood throughout the body. A blood pressure has 2 numbers, the higher number, systolic, and the lower number, diastolic. Systolic pressure is the maximum force being exerted against the arterial walls, as the heart is contracting. Diastolic pressure is the minimal force being exerted against the arterial walls, as the heart relaxes between each heartbeat. The normal range for systolic pressure is between 90 and 140. The normal range for diastolic pressure is between 60 and 90. Procedure guide for taking blood pressure. 1. Wash your hands. 2. Assemble your equipment, stethoscope, blood pressure cuff, alcohol swabs, pen and paper to write down the results. 3. Clean earpieces and diaphragm of stethoscope with alcohol and cotton balls. 4. Locate the brachial pulse on the inside of the elbow. 5. Wrap and fasten a deflated blood pressure cuff smoothly and snugly around the person's upper arm. Place the cuff at least 1 inch above the elbow with the arrow on the cuff pointing at the brachial pulse. 6. Place the earpieces of the stethoscope in your ears. 7. Place the diaphragm of the stethoscope over the brachial pulse. 8. Close the valve on the air pump. 9. Pump air to inflate the cuff until the needle points to 170. 10. Deflate cuff slowly and at a constant rate. 11. Watch the numbers as the needle falls. 12. Listen for the first thumping sound. If you hear the thumping as soon as you begin to release air from the cuff, stop and immediately release all of the air from the cuff. Inflate the cuff again, this time until the needle points to 200 and measure the blood pressure. 13. Note and remember the number where the first thump, systolic pressure, is heard. 14. Note and remember the number where the last clear thumb, diastolic pressure, is heard. 15. Deflate the cuff completely. 16. Repeat the steps if necessary. 17. Record the reading in the healthcare chronological, HCC. 18. Wash your hands. 19. Report abnormal readings, if systolic pressure is above 140 or below 90, if diastolic pressure is above 90 or below 60. Important vital sign numbers. Temperature. Axillary 95 to 98 degrees Fahrenheit. Oral 96 to 99 degrees Fahrenheit. Rectal 97 to 100 degrees Fahrenheit. Pulse. A normal adult pulse beats 60 to 100 times each minute. Respirations. The normal rate is 12 to 20 respirations per minute. Blood pressure. The normal range for systolic pressure is between 90 and 140. The normal range for diastolic pressure is between 60 and 90.